Good morning to you all and all those from the media who follow us every day. As usual, we're going to give you an update on the situation both abroad and at home. And also we will answer some questions that we have received. As of 12 midnight last night, a total of 182 countries were reporting COVID-19 cases. 2,197,593 cases had been diagnosed. That is 83,324 more than the day before. And in the day, some 8,000 people died as a result of this disease, for a worldwide lethality of 6.86%. In the region of the Americas, 826,282 cases were reported, 39,203 more than Friday, and this represents 37.59% of the total number of cases in the world. The region also reports a very alarming amount of fatalities for a single day, with 4,255 for a cumulative of 42,751 deaths, for a lethality of 5.17%. We always follow the behavior of the disease in the Americas, and as you can notice, the lethality is of 5.17%. However, there are 16 countries with higher lethality in the region, Bahamas ranks first with 16.67%, Guyana with 15.79%, Mexico with 7.72%, Honduras with 9%, Grenada, St. Kitts and Nevis, and the United States with 4.96%. Brazil has a rate of 6.32%, Ecuador has 4.9%, and so 16 countries of the 35 countries that make up the region exhibit higher rates than the average of the region. A total of 12,272 people remain in Cuba, of which 7,052 are Cubans who reside abroad, and 5,220 foreigners. In rental houses, there is a similar data from the one reported the day before. There are 948 foreigners in Santiago de Cuba and the municipalities of Plaza, Playa, Centro Habana, in Havana, with the highest number of foreigners. A total of 3,037 patients have been admitted to hospitals. 27 are under surveillance, 2,266 are suspected cases, and 744 are confirmed cases. We're keeping 8,134 people in primary care surveillance. For the detection of SARS-CoV-2 virus, 1,673 samples were studied. As a result of the study of the 1,773 samples, 49 tested positive for COVID-19, a total of 2.9% of the samples that were studied. Our country accumulates now a total of 26,982 people studied and 1,035 positive cases, for 3.83% of the people studied. Of the 49 new cases that were confirmed on Saturday, all of them are Cubans. Of these, 41 were contacts of confirmed cases, and in 8 cases the source of the infection could not be established. Of the 49 persons who tested positive, 24 were female, that is 48.9%, and 51% were male, so the ratio oscillates within that range.
En esa cifra, unas veces un poco superior un sexo, otro, pero siempre en el rasgo de los 50, 51 y demás.
And as we always reiterate, 51%, that is 25 of the positive cases, were asymptomatic. Of these 49 positive cases, the largest percent corresponds to the age group of 40 years of age and younger, with 23, followed by the age group of 40 to 60 years with 19 cases. The provinces with the most amount of cases are Havana with 18, Holguín with 12, and Villa Clara with 8 cases. And of these 8 cases of Villa Clara, 5 belong to a cluster that was reported and that has been active since Friday in a care home for the elderly in Santa Clara, which accumulates 57 positive cases, of which 43 are seniors and 14 are workers of the facility. This event resulted from a transmission that took place within the facility. Regarding the infection rate by provinces, including the 49 cases that were reported on Saturday, the Isle of Youth still leads with a 26.2% per 100,000 inhabitants. This is the cumulative rate. It is not the rate of the day. So the Isle of Youth is first with 26.2%, followed by Villa Clara with 21.5%, Havana with 17.7%, Ciego de Ávila 17.4%, Santi Espíritus 12.9%, Matanzas 8.8%, Holguín 7.1%, Mayabeque 6.5%, and Artemisa 5.2%. The rest of the provinces, although they have lower rates, we stress that the possibilities of contagion are just the same, and the measures of protection should remain as strict as in the rest of the country. Of the 1,035 patients diagnosed with COVID-19, 728 show a stable clinical evolution. 34 people have died. We have to report today about 2 deaths. The lethality in Cuba stands at 3.28%. 2 evacuees and 255 cumulative cases released from hospitals. On Saturday, 28 people were discharged. We are reporting 9 patients in critical condition and 7 are in serious condition, 2 more. As I said earlier, we have to report the passing of 2 people diagnosed with COVID-19. One is an 81-year-old male patient. He is a Cuban national from Havana, from the Cerro municipality. As pre-existing conditions, he had immunodeficiency, a chronic obstructive lung disease, diabetes mellitus, chronic renal insufficiency. He had been admitted since last April 6 at the Salvador Allende Hospital, and after 11 days of treatment at the intensive care unit, and despite all efforts to save his life, he passed away on Saturday morning. Y acorde con todas las patologías asociadas y la evolución de la enfermedad,
Después, en la tarde de ayer, fallece este paciente, en la mañana de ayer.
The other fatality is an 88-year-old Cuban female national from Santa Clara, Villa Clara, who suffered from chronic ischemic heart disease, diabetes mellitus, obesity, and she tested positive on April 16 at the nursing home in Santa Clara. She had been admitted initially. She was asymptomatic, and on the afternoon of April 18, she had several abrupt manifestations of pulmonary thromboembolism, a severe complication that led to her death. So this is the general epidemiological situation in the world and in our country.